Hi, everybody. Welcome. You're listening to the Boss Body Podcast. I'm Sarah Haas, and I am so happy to be here with you. And I'm so happy that you've tuned in to be with me today. I have an amazing guest. Her name's Elizabeth Kipp. And Elizabeth is a stress management and historical trauma specialist. And she's going to share a little bit about what that is and what that could mean for you. Also, Elizabeth is a best-selling author, and her book is called The Way Through Chronic Pain: Tools to Reclaim Your Healing Power. And Elizabeth helps people overcome and heal from trauma. She helps them overcome chronic pain and also addiction. And addiction also includes food addiction and body dysmorphia. So we are going to dive into all of that. I am so excited to get started. Elizabeth, thank you so much for being here.
Oh, thank you, Sarah. It's my pleasure to be here. I'm excited to be able to share with you and your audience, and then share your audience with my audience, because we intersect that way.
Oh, yeah, it is. It's so great when you meet somebody who is just perfect for your community, because I know that so many of the women listening struggle with chronic pain. They struggle with addiction. They struggle with feeling okay in their own body and, just not being able to figure out what it is, why those issues keep coming up, and they're stuck in this cycle and they can't seem to break it. And I think what you do is so amazing because you help them with these kinds of things. So I know you have more of a scientific background. So first I want to dive into all of that. Can you tell us what your background is and what kind of work you've done and are doing?
Sure. I really have a degree in plant science, and because because of the what I learned in the plant world, and how we're really we all live in a system, right? So I studied plant science, and I studied ecosystems, and I studied um, evolutionary biology, and then I got 6 credits short of my master's. I did some remote sensing specialist work as a plant scientist for on a NASA grant back in like 1970, 1980, and then 6 credits short of my master's degree in environmental studies. My An old injury in my back became very unstable, and I had to get surgery. So I had a lot of surgery to stabilize that. It took 4 surgeries to have that happen, and I ended up on a lot of pain medicine, opiate pain medicine, and anti-anxiety benzodiazepine class medication for 32 years.
Oh, wow.
The doctors that I saw, all except the last one, all really didn't have another answer for the pain that I was experiencing. And so here are your medications. And the last 15 years of that was fentanyl and Ativan. So that's, potent, and it wasn't just a little dose. And I'm just a
Yeah.
little person, so
Some pretty strong drugs that you were on to
it
help
was
control your
yeah.
symptoms.
And really, I got to the point where I was just like, I'd rather deal with the pain than all the side effects of these medications. And I found a doctor. Um, his name was Dr. Peter Prescott. He wrote a book, Conquer Chronic Pain: An Innovative Mind-Body Approach, and he actually understood the nature of chronic pain. All the other doctors really didn't. They weren't trained in it, because it's not typically something that you're trained in medical school. And so they said, "Oh, you won't get better, and you're not going to get better from this. So this is the best we can do, is give you this medicine." And as a scientist, my understanding when they said that was, you're telling me more about the limitations of the model you're working with than you're telling me about the body's ability to heal. I just, because I learned how to do science research, and science is a self-limiting framework. So when you make a conclusion, you have to back up and see what your assumptions are, right? And they're like, they're assuming I'm not healing. They never asked because of their assumption that I wouldn't heal because they didn't see that possibility. They didn't ask the question, why isn't Elizabeth healing?
And I
So
love
you
how your analytical scientific mind just went right to work with that. And what you said about this is the only tool that they have. And therefore they think, okay, there are no other tools. And when you hear that, a lot of times you just take it at face value and you say, "Oh, okay. I guess I just need medication and this is what I'm going to be doing for the rest of my life." But I love it when people decide to empower themselves to do some research, and because there are so
Mhm.
many alternative modalities out there that can help. And it may be that you still need some medication, but there's so many things that you can do to help alleviate some of that besides just medication. And when you hear from someone, this is all there is, what you really want to think in your head is this is all that person has for you. It doesn't mean that's all there is.
That's right. So when I sit in front of a healer, it doesn't matter what kind of healer they are or where they're from or any of that. I ask myself, what do they bring to the table and what are their limitations? So that I understand the lenses they're looking through, including me, right? Including me. So the thing about chronic pain is it's any pain that's felt 15 days out of 30 for 3 months or more. Any pain, physical, mental, emotional, spiritual, financial, anything that's uncomfortable, that doesn't feel good for 15 days out of 30 for 3 months or more is chronic. The brain can't tell the difference between a broken bone and a broken heart. So grief is a chronic pain experience. When it's most of us have had that experience, we it lasts a while. And why is that important? Grief and like lots of other things that people listeners will understand. Why is that important? Because the brain is fundamentally changed by the chronic pain experience. The brain is constantly adapting to the circumstances that it experiences, to the environment that we're living in, that the information coming in is constantly adapting. And in the chronic pain experience, the brain makes some fundamental changes. For instance, we get a lot of brain fog and confusion in the brain. The emotional center in the brain is also um, affected in such a way that we get a lot of negativity. That's probably something that you're familiar with in your own clients. This tendency to be negative, this kind of like I'm not enough. It doesn't matter what I do, I'm still not going to make it. You know, these kinds of that's a brain on chronic pain if it's persistent, if this is something that you can kind of tell after you've been, I mean, I was there for so long, so I can pretty much tell a brain on chronic pain when I hear it or see it. Um, so here's the thing. Opiates and benzodiazepines do not heal the changes in the brain that occur because of chronic pain.
They're
You're
treating
talking about,
symptoms. They're not treating
yeah,
root causes.
yeah, and they actually can be exacerbated. So, uh, because of those things, some of those symptoms can be in it, which I could get into a whole thing about that. I'm not going to, but there's a whole another conversation we could go in there. So we need to bring in modalities to heal those changes. And the work that you and I do are things that help heal in that space. Yep.
Yeah, absolutely. And, I always try to stress that mind body connection. You cannot heal one without the other. And when one is in pain, whether that's physical or emotional, the other will be affected. And that's one proof of that is that a lot of people who are in chronic pain are prescribed antidepressant medications, and the medical field doesn't know why that helps chronic pain because scientifically it's not treating a symptom, but it works and they use it regularly. And that is just further proof to me that when your mind feels better, your body is going to feel better.
Yes, and there's actually a high in the trauma world, from a trauma point of view, there's actually a hierarchy of healing. First, nervous system regulation. Second, connection with within ourselves, with another person, with source, right? With God, with whatever consciousness, whatever you want to call that. Third, learning. So we can't, the mind actually follows the nervous system. So when the nervous system is dysregulated, the mind is just busy, 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 and usually negative spiraling. So the first thing that, I've just been in this for long enough, the first thing that I usually do when I get in conversation with another person is assess their nervous system. That helps me know kind of how I need to meter my tone of voice, the speed of my speech, kind of melody, where the pauses are. I'm not going to look directly at, stare them in the eyes. I'll make contact and then look away, so not to be threatening. There's a bunch of different things to do there to try and our bodies right now are actually talking to one another. Our nervous systems are assessing, are we safe? And we are. So we're co-regulating. That's called co-regulating, right?
Yeah, I like
Well,
how you tap into the person in front of you to
mhm.
help that lead you in how you're going to treat them, because you have to meet them where they are. And if the way that you're talking or the way that you're being with them isn't going to jive with where they are, they're not going to be able to absorb it. So
Mhm.
I've really liked that you start with that. Can you explain a little more what you mean by trauma?
Oh, yes. Dr. Gabor Mate and Bessel van der Kolk give a very good definition for trauma. Trauma isn't what happens to you, it's what happens inside of you because of what happens to you. And what happens inside of you is we get disconnected from our true selves. We get we get jostled. We become in this very unfamiliar space. We don't know what to do with ourselves. We become disconnected from others because we can't actually share the experience that we just had, and we get disconnected from consciousness. We feel separation. So unresolved trauma in the system, um, you know, so many people have it. I'm pretty much probably everybody has some degree of it or another. But it's this lack of disconnection. Um,
So trauma
Interesting.
can, be traced back to things that happened in your childhood, things that, you experienced in your family of origin or with relationships, any divorces, there's so many things that can cause trauma. And so what you're saying is if that stays in your system and it isn't dealt with, then your nervous system reacts to that trauma, and then that sets off the chain of events.
Sure, you can get I had an event when I was, I don't know, 3. I had an event with my mother that was very traumatic, and I'm, by the way, still working on that. I'm aware, and I've done some very interesting therapy around it, and I've kind of rewired a lot of the reaction around, released a lot of the stuff around it, and I still feel like I've got another layer or 2 to get to, but the thing is that when we have a trauma at a certain age, and I made that one just because it's the one that came to me. It's the earliest one that I can really consciously remember. Um, if we don't resolve that, a part of us gets fractured and stays in that at that age, in that unresolved space. So we become we become um, each time that we have a traumatic experience this remains unresolved, and a lot of us had stuff with kids and accidents and things happen, and we don't resolve it, then we have these parts of us um, we get stuck at those ages, and they kind of get splintered off, and um, we become fractured. And we do there are beautiful modalities. Internal family systems is an example of of Dick Schwartz does great work. Dr. Richard Schwartz Um, there's great work there to help us integrate. It's not the only way, but it's a beautiful way to integrate us back into wholeness. We were always whole. We came in whole, but we took on these. We had these experiences that blocked us from realizing our wholeness.
Yeah,
If
and I think, like you said, we all have experienced multiple traumas throughout our lifetime. And sometimes we're conscious of them, sometimes we're not. But a lot of times we know exactly what traumas we experienced, but we don't want to deal with it because it's hard, it's uncomfortable. It's not it's not something that it's something that you feel like you kind of want to avoid because it's painful. And we think we can just compartmentalize it. We think, okay, well, that happened. Yes. Now it's not happening anymore. I've moved on. And what we don't realize is that's still in there. It's still affecting us physically, mentally, and emotionally. And what I see is patterns in your adult life. Things like overeating, food addiction, because of past things that you haven't resolved. And they want to come up and you want to stuff them down. So you sometimes do that with food, or you just don't feel good and we all need and want to feel good. And food gives you that kind of temporary boost.
absolutely, absolutely. Also, there's intergenerational trauma. As you said, some of it's unconscious. Um, we know from, for instance, from Rachel Yehuda's study with Holocaust descendants of the Holocaust, that that the descendants of Holocaust victims or survivors of the Holocaust um, process cortisol, which is a stress hormone, differently. They're not as resilient. So there's an epigenetic change in subsequent generations from the offending event, the traumatic event that gets passed on. That's why I do ancestor clearing work. Is that it addresses that. So there's trauma in this lifetime, but there's intergenerational trauma that gets, if it's remains unresolved in the system, we suffer the effects of that as well.
Yeah,
So
absolutely. And we of course we know that we inherited some feelings, behaviors, whatever from our mothers, and we know that we pass those on. And I always tell myself all the work that I do is only going to benefit my daughter, which is going to benefit her daughter, or sons. I shouldn't just say daughters, but you pass that down with your actions, and physically in your body with it. If your great great grandmother had that amazing trauma, like you mentioned with the Holocaust, that changed her physical body, and that gets passed down because however you are when you are pregnant, all that stuff it affects the fetus growing inside, and then it affects their physiology. And it's so true, and we don't realize that. But I love it when people want to dive in and clear some of this so that they can look forward and see the healing that's going to come
Mhm,
in the generations
mhm.
to come.
Yeah, it's exciting to I love the I mean, I love all the work I do, but the ancestor clearing piece of it's so interesting um because people feel lighter. Because the thing is when we do the work, the thing is that we actually don't know the burden we're carrying because we came in with it. So we're used to carrying it. And we don't realize it until we're not carrying it anymore, that, oh, I'm lighter, right? It's so interesting.
Can you explain what the connection is through all of this to addiction?
Yes, yes. So um, at the root of addiction is a disconnection. Addiction is a disconnection, right? It's a disease, dis-ease of disconnection. So in trauma, when it goes unresolved, we get disconnected from ourselves. Chronic pain is another example of an experience of disconnection, which in my case, I didn't know it until after I worked with Dr. Peter Prescott. In my case, it wasn't about my back. It was about all the unresolved trauma in my system that happened to kind of accumulate. That was like the back surgery was the straw that broke the camel's back, as it were. So, um, so I had unresolved trauma. Then I became a chronic pain patient, and then I ended up in addiction because we're trying to deal with. I'm trying to look for an answer outside of me. I didn't understand how to look within to solve the problem. If I had known, I knew when I met Dr. Peter, but it took me a while to get there. So so addiction is really the result of unresolved trauma, because we're looking for a way to soothe, to find safety, to find it's not so much why the addiction, it's why the pain that's underneath the addiction. Right?
Yeah, and
Addiction's not a moral failing. It's a dis-ease around. It's a strategy to keep ourselves feeling some level of safety. When it's not a healthy strategy, but it's the one that worked for us in the moment.
I was just thinking about this the other day because, I live out in the Appalachian Mountains where there is an explosion of addiction to especially, Oxycontin, those kind of pain pill type things, but other things too, alcoholism. And people do look at it as some kind of moral failing. But anywhere where you see lower socioeconomic areas, you will see higher addiction rates and drug use. And part of that is because these people are in pain. They're unhappy. They have food insecurities, they have financial issues, they're homeless or struggling. And anytime there is struggle, there's pain. And anytime there's pain, we look for ways to alleviate it.
Absolutely. Yes, and I would expand your vision for just a moment, because the National Institutes of Health before COVID estimated 25% of the entire North American population was in chronic pain across all socioeconomic measures, including age groups. So not just geography and economic status, but age groups as well. So children, 25% of children. And the World Health Organization estimated a fifth of the world. So it's yes, we have specific issues in the areas that you're talking about, and there are other issues in other areas, and it's this silent epidemic of chronic pain, and we also see the addiction following, because they don't know any other way to self-soothe.
Yeah. And so anytime you have chronic pain, whether that be physical in your body or mental and emotional because of unresolved or your life circumstances, you will tend toward addiction to feel better. So I love that because it's such an enlightening way of looking at it, and it's so true.
It is true. The work in recovery from addiction and trauma, all of it is and chronic pain as well, is being able to work with another person, because we have to do this in community, with another person or in a community, both, so that the person that's suffering can actually start to look within and feel safe in their skin, and then start to feel the feelings and feel safe with them, and then allow the stuck energy in the body around all the unresolved trauma to release. And that's the core of the work that I do.
Yeah, so you use all these different modalities. I know yoga is
Mhm.
one of those to help people work through and release that trauma. And in doing so, they release the chronic pain.
Yeah, I'm not a trauma therapist, but I'm a really good coach in that space because I've been through the modalities and I've had lots of training and I have an understanding of kind of how these things work, but I want to be really clear that I'm not a trauma therapist. Right.
Right. Right. You're not a therapist, but you have modalities to help people deal
Mhm.
with trauma. And I think it's so important when you are struggling with something like addiction or chronic physical pain to seek out more than one modality. You
Mhm.
know, of course, the medical field is one that can be really important and really helpful. Also, professionals in mental health professionals in that field, and then alternative practitioners like you, because we come at it from all these different angles. And the more support we have, the better success we're going to have.
Mhm. Absolutely. And everybody's different. So, and depending on where they are in their journey, they might need one modality uh, as a support to support another one, and it kind of depends on where they are. Yeah. So, for instance, uh, acupuncture has been very helpful for me. That's a that's just kind of I wouldn't say it's boilerplate, but I have fairly regular acupuncture sessions, and and then if I have an injury, which I've had a few over the years, I have more of those sessions because it's very helpful at like stimulating the immune system and so forth. So acupuncture is a really good way. Yoga is amazing. Again, community really important, a really important part. If you can get connected into a community that's doing this kind of healing work, you'll run into all kinds of people and they'll be able to kind of help you, and you'll have the support and they'll be able to help you, share with you, oh, this worked for me, and go see that person, and and oh, that person worked for me, and they did this, and all that kind of stuff.
And realizing that you're not alone. So many times we
Yeah.
think whatever we're struggling with is unique to us, and we feel bad about ourselves. We think, why can't I deal with this? Why can't I figure this out? And then when you get around other people who are experiencing similar issues, it is such a relief to say, oh my goodness, okay, I know I'm not alone. I know there's nothing wrong with me. And you can see other people who are having success
Mhm.
and learn from them, and it helps motivate you and move you forward.
You're
So I
talking about,
want
okay, I was just going to say, you're talking about the second level of healing, the connection part. This is so
Mhm.
important. You can't really learn regulation, connection, and then you can learn new things.
Yeah.
That connection piece is so important. Yeah.
Yes, I agree 100%. So I always like to leave my listeners with some kind of actionable step that they can take
Mhm.
toward feeling better, living better, whatever that may be. So I would love for you to share something simple that those who are listening who maybe are experiencing some kind of pain or addiction or similar issues. I mentioned body dysmorphia, and we haven't had time to dive into that, but so many women, oh my goodness, almost everyone struggles with that as well. And I would love for you to just give us a simple practice that can help us begin that journey.
Beautiful. I'd love to give you a very simple breath practice that helps to balance the emotions and balance both hemispheres of the brain. It's really simple, provided you have access to your nostrils for breathing, because we're going to use one nostril and the other. So we'll begin just sitting evenly on both sitting bones. I'll do it for maybe a minute and a half ish. You want to do it for 3 minutes, but for the sake of the podcast, so you see kind of the sequence, we'll do it for about a minute and a half. Sitting evenly on both sitting bones, straighten the back and relax the shoulders back and down. Raise the heart so you have full access to the lungs. And then I'm gonna um, I'm gonna inhale on the left side. I'm gonna cover my right nostril and I'm gonna inhale on the left side. Nice, long and slow. And I'm going to cover the left and exhale on the right. Nice, long, and slow. Now inhale on the right, long and slow. And just before the exhale on the left, we're going to switch. Exhale on the left. And inhale on the left. Switch nostrils just before the exhale on the right. Inhale right. Switch just before the exhale on the left. And inhale left. Switch just before the exhale on the right. Inhale right. Switch, exhale left. Always switching before the exhale. Now just inhale through both nostrils to end. Exhale through both nostrils. And just sit maybe for a minute and allow the body to integrate the information. We've just given very specific information, stimulated the brain in very specific ways, and you allow it to integrate. And 3 minutes, just even a minute and a half of that, I can feel the change. But 3 minutes of that really will give the nervous system a chance to, especially if you're feeling like agitated and what I would say dysregulated, if you're feeling agitated, anxious, 3 minutes of that, you'll be a different person.
I love that because it's just kind of like a recalibration. It's like a calming, and we all need that because we go, 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 and we're stressed. And it's 3 minutes, guys. Anyone, and you can go in the bathroom at work and do this practice whenever you need it. So I'm definitely going to be incorporating this into my day, maybe between clients, just to recenter myself between, from one to the other. So thank you. I love that. That's so helpful. And I just want to thank you so much for being here today and all the information you shared, because I really feel like there's going to be a lot of people listening who have aha moments from everything that you have said. So I want to thank you so much.
Well, thank you, Sarah. It's my pleasure to be here. And again, I'm really thrilled to be able to have our audiences, um, share each other.
Absolutely. Absolutely. All right, everybody. That's all I have for you today. And thank you so much for being here. And I'll see you next time.